Good afternoon, everyone, and thanks for joining us this afternoon. I'm Sean Godar, Director and Team Lead of Analytics and Employer Solutions at Employers Health, as well as the Co-Director of Right Direction. Today, I will serve as a moderator for this event. A few housekeeping items before we begin. All attendees are currently in listen-only mode, so please send any questions you have using the question function in your control panel. We look forward to addressing any questions that you have at the end of the presentation during the Q&A session. If you ever have any difficulties hearing me, please raise your hand in the control panel and we will be in touch to assist. Finally, you'll notice that there is a handout section in your control panel where you can download materials related to today's presentation, as well as some extra materials such as how Kent State supported employees through COVID and other workplace resources. Upon exiting the webinar, you will receive a survey to provide feedback. We appreciate all attendee feedback in order to provide future valuable education opportunities for upcoming events. We will also send out a follow-up email tomorrow with a link to the recording of the event and its accompanying handout. Submit your questions at any time in the chat function, and we will answer those during the Q&A session. And with that, I'm going to turn it over to Darcy Gudadaro, Director of the American Psychiatric Association Foundation's Center for Workplace Mental Health and fellow co-director of Right Direction. Darcy?
Thank you, Sean. It's great to be here, and thank you so much for participating. We're extremely fortunate today to be covering real-world results, employer tactics to enrich your workplace mental health strategy. We are very fortunate to have a person that we've been working with, and I'm going to describe in a bit more detail as we go through the slides. First, though, I want to say welcome, and just to remind everyone that Right Direction is an online community. We offer free resources for raising depression awareness in the workplace and demystifying symptoms and treatment options. This was created through a partnership between Employers Health and the APA Foundation Center for Workplace Mental Health. You can see there as our website for Right Direction. So we really encourage you to visit that to see all the resources that are available. Just to give you a taste of what we offer, these are the tools. These are free and customizable. So if you want to put your logo and specific information about your organization on the resources, that's certainly an option. There are slide decks and posters and infographics, email templates, cost calculators, videos, and more. And we are on a regular basis updating the information and resources that are available. I did want to mention this is the next in a series of our virtual town hall meetings. We were very fortunate last month to have an excellent presentation on mental health, depression, and ending stigma in the construction industry. That's currently on the Right Direction website. We also, in the month before, had a presentation that we got very high praise for on mental health, organizational culture, and compassion in the workplace. And we started out with introducing Right Direction as it was relaunched and reimagined in May to honor May as Mental Health Month. I did also want to share that we are, as I mentioned earlier, consistently adding new resources to the website. This is particularly important right now as our nation is experiencing a surge in mental health concerns, especially related to depression and anxiety. We have recently added a resource on positive mental health programming that really talks about how you can develop programming at your organization focused on depression and broader workplace mental health. We also added a new resource on telemental health, virtually expanding access to care. This is obviously important right now since our nation over the last 4 months really stood up telebehavioral health, and most people are accessing mental health care virtually through video connection and also through telephonic means. And then, of course, we are constantly updating video clips that are available, the most recent one on recognizing depression from a CBS anchor. So those are our latest additions. I did want to share the US Census data showing that we are seeing escalating rates of depression and anxiety in the US. And I know this is hard to see, but on the far right, which is circled, It shows the national estimate of people experiencing indicators of anxiety or depression in mid to late July at 40%. We have seen reports of a tripling of people experiencing these conditions. Also, it's hard to see as well, but they do share age bands of people experiencing depression or anxiety. And it's very telling that the highest percentage is in the 18 to 29 year age group at 55%. So that is a big jump in the number of people experiencing these issues. So it's extremely important that employers really work to address depression in the workplace more deliberately, and also ensure that people have access to care. So we really want to focus on the fact that Right Direction offers the opportunity to end stigma, which is of course an ongoing barrier to people accessing care. We want to make sure that people feel psychologically safe to seek care when they need it, because we know that promoting early intervention is the key. Like any other health condition, getting help early really matters. So we offer through Right Direction the opportunity to raise awareness. And I'm really excited that we have Kim here, who's going to talk about how they've done that at Kent State University, but also the importance of improving access to care, because we can raise awareness and we can help to build mentally healthy cultures in which people feel more psychologically safe seeking care. But if we don't have access to care available, it's kind of undermines the other work. So we really want to make sure that people can access care when they need it. So at this point, it is my absolute pleasure to introduce Kim Hauge, who is the Director of Employee Wellness at Kent State University. She's worked there for nearly 20 years in benefits administration, communication and project management, talent acquisition, and employee wellness. She is responsible for the strategic planning and management of a holistic employee wellness program and leads design and administration of the university's benefits program for faculty and staff. I did want to mention too that we had the absolute pleasure of working over the last several years with Kim on a research project that she's going to talk with you a little bit more about, and the research findings. Kim was an absolute great partner and teammate to work with on this project, and we've submitted the research findings to a peer-reviewed journal and are awaiting publication. So I just want to thank Kim for her leadership and her partnership in working on that research. And at this point, I'd like to turn it over to Kim.
Well, thank you very much, Darcy. Okay, we'll just transfer slides here and get going. Okay, I just wanted to talk a little bit, just briefly, to give you an idea of the size of our entity here. So if you're not familiar with Kent State, we've been around for quite a while. We have about 39,000 students, about 5,300 employees. Unfortunately, due to COVID, that number is down to that 5,300. During the time of this research, we were steadily pushing closer to 6,000. We do have a multi-campus work site, so we do have 8 campuses around Northeast Ohio going through the state, but we also do have locations in New York City and abroad. So today during this town hall, I do want to give you some background, and we're going to kind of look at 2 time frames here. So how we first got started, and I want to call it kind of baby steps, and then how we took a second look at what we were doing, how we were doing, and what that longer commitment to that holistic well-being. So in 2014, as Darcy was talking about Right Direction, they were just in their kind of infancy stages themselves. They were launching the tool, which Right Direction is at that time was the first of its kind, depression awareness and anxiety. So we knew when we were going to venture into, this personal well-being, what that was going to look like, that one of the things that we wanted to address was this work-life balance and mental health. But how were we going to start those conversations? As some of you may be feeling or experiencing, how do you really start that conversation around mental health when it hasn't really been part of your culture? And that's where Right Direction was extremely helpful, because they have toolkits there that really help you address this issue, not only with your leadership, your C-suite, but how do you have these conversations as well with the employees? Because it can feel very personal, and it could, if not done properly, feel like perhaps an invasion of privacy. So as we were taking our look, several people will ask the question, well, why did you even want to address the issue of depression? So in looking at our data at Kent State, we could see that depression was one of the most cited reasons for individuals going off on FMLA leaves. So that, as you know, not only are you losing the productivity, but that means that their health is obviously jeopardized as well. Also, when we presented our health risk assessment data, employees are offered the opportunity to take a health risk assessment really at any time during the course of the year, but we do make a bigger push around each fall so they can kind of have that apples to apples comparison, not only for themselves, but we can look at aggregate data and see how we're progressing or what risk factors might be out there. And what we could see in the aggregate data is that for our population, depression was significant as a health risk. We also looked at our pharmaceutical data, and I'd like to remind everybody, you probably all have access to this type of information. So if you're wondering or establishing or trying to make a case for your campaign around mental health, these are some of the great tools. So we could see in our pharmaceutical data that medications for antidepressants were always within the top five or so, 5 to 10, and that often that holds true often year over year. And then we could also see that we were spending significant claims dollars for depression-related treatment, not only for employees, but for family members. So this is some of the information that was very telling to us as to why we needed to take this deeper dive. So what we set out to do, using Right Direction as our toolkit, because we never considered ourselves all-knowing on depression, but as I said, the wonderful thing about it is there's vetted high-quality information within the Right Direction toolkit. So we took that information. We also partnered with our employee assistance program, which happens to be Impact, and we designed a communications campaign. So we went out and did meetings together, HR representative, our EAP, using the Right Direction information as part of slide decks. As Darcy alluded to, there are slide decks in there and a variety of other wonderful tools that you can use, so you're not starting from scratch. So we did 2 tracks, really. A manager track to help inform them as to why this was significantly important, and also how to recognize the signs and symptoms and be that empathetic coach or listener that might help get employees to the resources that they need. And that's why it was also important to have our EAP right there, because they too could talk about how they could help support the university, the employees, and their families. We also made sure that we were very present at different types of activities. So we had our open enrollment fairs, which many employers have during the fall. We made sure we had ourselves there, our material there, including our Right Direction material. And then we showed up at other events like employee appreciation events. What a great time to connect with employees and have information readily available. We customized the materials, and I'll show you some examples here shortly. And we continue to have ongoing communication. So we didn't make, what you'll see is the long-term effect that we didn't just do this once, but we needed to continue to have communication. And I will be talking about communication strategies very specifically later in the presentation. So these are some examples of the Right Direction materials. If they're a little bit hard to see on this slide, I apologize, but you'll have access to the Right Direction website where you can see these. These are very helpful for planning your employee meetings, putting up posters, maybe in break rooms. You'll notice here that we co-branded. You can see our Kent State logo, which we really encourage people to make it your own. You want to make this feel very normal within your environment. So we have our Kent State logo on there, but we also have our EAP logo. So we're trying to drive that connection that Kent State's here, Right Direction as our learning tool, if you will. And guess what? If you're ready to take that next step, we have the resources in our EAP. We co-branded the websites. When our individuals log into Right Direction, we have specifically our Kent State logo on there. So co-branding, again, to help make it your own. And then on our Impact website, we also cross-reference. So you'll see there our Kent State logo at the top, the Impact logo, and Right Direction. So we're always reminding people and helping to make this connection too, because it wasn't intuitive, it wasn't natural, that wasn't necessarily our culture. We did take a look at our initial campaign. Now our initial campaign, because we're this multi-site community, took about 4 or 5 months to roll out. So we looked at some of the data, EAP specific data, to see, were we making a difference? Were we seeing more traffic? And what we could see is that employees were in fact going to the EAP website. They were calling in more. They were actually identifying that mental health was one of the primary conditions that they were calling in. So we did see some very positive results. So we knew we were on to something. We also looked at the claims data for this cohort population that were already diagnosed, and could have been through their claims data, pharmaceutical data, with major depression. And what you can see here, we didn't decrease the number of people that identified as being depressed, but in that last row, notice the emergency room visits. They are down, and so are admissions. So what we are hoping, of course, we can't prove it, just from this preliminary data, that individuals are seeking help in getting self-care prior to them getting very acute and episodic and having to be admitted either through the ER or admitted to a hospital for mental health reasons. So this was very encouraging at the forefront. And this is what it translated into as far as cost savings. So we can see in that population, the per member per year reduction was about $5,000 claims dollars for that population, that specific cohort. So as I said, we felt that we were on to something good, but we had more work to do. So just keeping, depression out at the forefront, we wanted to make sure and really reevaluate and evaluate what we were doing, what our belief systems were going forward. And this is also, there was a change in leadership as well during this time. So we did know that depression continues to be a burden globally, and that 1 in 5 adults has a mental illness. And it's also a leading cause of disability, which we should all be concerned with. Half of the individuals usually don't seek treatment because they may not be fully aware that the signs and symptoms that they're feeling are associated with disorders like anxiety or depression, or they're afraid because of the infamous stigma that translates around it. There was a great research article done in 2018 by Evans, Lako, and Knapp, and they talked about depression is experienced by a significantly large population of employees, and it's often so taboo that they don't tell anybody, and that the results from their study show that approximately 70% of people with mental illness actively conceal it. So we know if they don't seek treatment, it's going to show up in other places as well. It's one of the leading causes too for heart disease, diabetes, and other comorbidities. So we want to make sure that they're feeling comfortable, that they recognize the signs and symptoms, and that they're going for treatment. That we were sure of. We know that we needed to continue to do targeted and consistent messaging, that it couldn't be a one and done. So it was great that we did this early campaign and it took XYZ months to roll it out, but then what? What were we going to do? Employers and human resource executives, we feel, have a large part in how we can help keep people informed, and that it's really our responsibility to advocate and provide this type of information that we were very consistent on. We also wanted to fully appreciate the interconnectedness of health. So one of the organizations that I'm part of, and I believe very strongly in their concept of holistic well-being, is that through the National Wellness Institute. They're a big influencer with us, as well as the Wellness Council of America. So what we wanted to do for ourselves, but also for employees, is to let them recognize that all these dimensions of wellness, and there's many wheels out there, right? But this is just one of many. It's all interconnected. So if we're ill in one area, it's going to affect these other areas. So there's nothing to be ashamed about when it comes to mental or emotional well-being. It's just part of how we are well. So it is just that, it is what it is. So we wanted to, and this too helps break that stigma, and it helps us as an employer weave in the mental health conversation with all sorts of different wellness conversations that we have. We also looked at different models that for health promotion, for instance. One in particular that we work well within is the social ecological framework here. And what I like about this model, and I think other employers, executives, anybody that's listening, you can really make impacts at various levels, right? We can just focus on the individual, but if we put an individual into a toxic or not healthy work environment, how is that going to help them? So we really spend a lot of time working in that individual, interpersonal, and organizational level. And I'll give you an example of something that we have done recently on an organizational level. And we feel that this not only honors mental health, but all aspects of well-being. So one thing that we never had at the university, and not many universities do, have flexible work arrangements or telecommuting and that type of flexibility that really allows people to have a little bit more balance and takes off some stressors. So we strongly advocated for a teleworking, flexible work arrangement here at the university. We spent a very long time putting our argument together to take to the C-suite. It took about 2 years, but last July we were able to put in place, ironically, pre-COVID, a flexible work arrangement policy. It has really made a substantial difference in that we get many letters from employees saying what a difference this has made, you know, allowing them to come in maybe a little bit earlier or leaving later. They're still working their 40 hours, but they have more flexibility in doing it. COVID certainly has taken care of a lot of that, with the teleworking and telecommuting being very much the norm now, but that certainly wasn't the norm, you know, pre-COVID here. So those are things that you can do at that organizational or operational level that have an impact all the way down to that individual level. So, and then we honor the person, the individual too, you know, really recognizing that there are many factors that play into their health and well-being, and we respect them for wherever they are on that spectrum. But as an employer, it gives you, no matter what size you are, a lot of leverage points. You know, 1 week we may be focusing, or one program may be focusing on that individual aspect, while others are at these larger ecological levels. So taking all that information, you know, that was kind of a looking forward as to what we were going to do here at the university, as far as what were we going to look like going forward. So we did brand the program the Kent State of Wellness. It does have the employee focus, which is where we are at, and that is where my focus is even currently. We also look at student, and hopefully to have more impact on the communities that we all work and play and live within. So this is our why. Our why statement is that we're here and we support the mission to promote optimal health and well-being for our faculty and staff through programming and best practices that permit our workforce to increase control over their lifestyle choices. The next sentence, I think, is the very important one. We recognize that wellness is multidimensional, interconnected, self-directed, and evolving for each person. So we're all at different aspects of well-being or being well on any given day, quite honestly, but it can change from time to time. So we meet employees where they're at. We believe in this holistic model of well-being that takes into all dimensions of wellness, and we provide and use population health strategies and ecological models because they truly do honor the person where they're at. It recognizes all the factors that affect our mental, physical well-being, and that these factors may potentially have impacts on where we are in the spectrum. And of course, we embrace these research-based and best practices. So spending a little bit of time as to how we continue to do our work. So one of the things I wanted to emphasize here too is we didn't go out and partner with any big partners or entities or purchase new programs. We really looked at what do we already have in-house. So for instance, we already partnered with a wellness company that does services, will provide services such as biometric screenings, health risk assessments, online health risk assessments, that does telephonic, or right now we're also virtual coaching, health coaching. They do oversight for things like if you want to provide incentives for your wellness program. We actually had that in play, but we were really maximizing those resources. So we looked again at that and how can we maximize BeWell's resources for where we're trying to go and for our belief system about whole well-being. Same thing with impact. We had an EAP. It was a checkbox. We weren't doing all the things that we could do with an EAP. So we had the conversation with them about where we wanted to go. Wellable is one of the most recent companies we have partnered with for a totally different reason. That was just here this year to help supplement. But what other collaborations, where were those other leverage points that we could use here at the university? So how could we use things like student recreation and wellness services? How could we use our university health services? We have a women's center here. How could we use them to promote some of the stressors and other things that women particularly go through? We have a speech and audiology clinic. How can we use them? So these were all resources that were around. I would say, I realize that people listening here aren't all with universities, but what do you already have around that maybe you haven't tapped into that you can use to supplement mental health and other forms of health? We tapped into banking relationships that we had to do more things around financial health or scams that affect us, things like that. And then your partners with your healthcare. What might they have that they could help supplement? And your pharmaceutical partner, what might they have? So all of these, as I said, existed, but we were not in a position where we were really maximizing them. So, and they all now interact with each other. So if BeWell has somebody come in that might have diabetes and they're being health coached, they may have very likely some emotional health needs, and they can also do a soft referral over to impact and vice versa. So everybody knows where we're going, everybody knows our why, and they're all on board. And this has really allowed us to do and be very effective in what we're doing. Other information that we've used to help drive our decisions, and again, we talked about this a little bit at the beginning, look at your pharmaceutical data. If you're trying to figure out what your employees need, where some opportunities may be, are you seeing antidepressants and things for anxiety in your pharmaceutical data at a very high level that may indicate to you that you can do more interventions around those types of needs? Your medical claims data, like I said, health risk assessments that you could offer employees to take voluntarily or otherwise. We do everything voluntarily here at Kent State. We do not make anything conditional. We don't really believe in that philosophy, honoring what I've said earlier about honoring employees where they're at. So we don't want to do any arm twisting here. We just educate them and put the information out there, and then we let that take hold as it will. EAP data, like I said, our EAP has been a wonderful partner. So we constantly are doing data checks with them and having conversations with our account manager about how they can continue to support not only mental health, but some of the other health concerns that might exist. And then surveys that you might do on your own. Do you do various climate surveys, for instance, or perception surveys? That's one that I love to do. We do one every year so that we can take that information and use it to identify the types of things that would be effective for our employees. And then once you've kind of done that homework, if you will, make sure that your interventions and your messaging is really about what they need, not what you think they need, but what the data is letting you know that they need. So for instance, if we're doing a workshop on financial health, which might be a safe entry point. So many employers have asked me, where do you start? Well, you can start with something like financial health that kind of is very non-threatening to a large population. It might be, about first-time home buyers or things that that type, but you can weave in the information around mental health, for instance. Some causes for us getting into some of these predicaments that we do financially is because of there may be some emotional factors there, or maybe in the day of COVID, they may show up at your financial wellness because their partner or spouse has lost their job and they're looking for more information. So that's a perfect opportunity to weave in things like stressors that may be leading to X, Y, and Z, and to work in your EAP. And for us, we go to our EAP because we have these, quote, like professional development credits. So when we look at what our employees are indicators are showing us that they would benefit from, we then work with our EAP to identify those professionals that can come in and host workshops that are very specific. And that's how we continue to work those leverage points and make the EAP very relevant, or whoever it is that that can help you most. So I would say to those that may have EAPs, and we know what they all say out there, right? That utilization is always around 2 or 3%. Well, should it really be there? What else can your EAP do? What are the depth and breadth of services that they have available? And have you asked those questions about how they can better serve your community? And the other thing I can't overemphasize is the importance of communication. So I call it very rhythmic and predictable communication. And this is an example of what ours looks like. So we send out targeted emails about every 7 to 10 days, and we call them employee wellness updates. And we never seek to overwhelm. So we just like to give things in small chunks. So we'll talk about the next 2 or 3 things that are coming up that they might be interested in, and really, help it be, where's the value to them? And if they want to enroll, this is how to enroll. We also do notifications on our internal intranet. So we have a little notification button, and we'll put some of that same information up there. So it may be staggered. The email might go out on Monday, and maybe the following Tuesday, you'll see a reminder up there on the intranet. We also have built a nice little network of employee wellness ambassadors. These are volunteer employees that have just stepped up and said, yep, I want to help build a healthy culture here too. And we consider them an extension of us. We buy them polo shirts, and we do have like a informational session that's really targeted for them twice a year, usually in the spring and fall, and talk about what's going on, what challenges, what other programs might be beneficial. And they're a great resource, particularly because of those regional campus areas where people can tend to feel that they're left out at these other locations. So we really have worked hard to overcome that. We do prepare a brochure once a year that we send out each fall, usually around open enrollment time. We have a digital landing page that always make it easy for employees to find anything. And we have a faculty staff news that goes out from our division, and we usually drop 1 or 2 of those upcoming events into that news too. So it's all kind of staggered, and they see things multiple times because, let's face it, we're all busy. And if we don't get, these kind of little nudges here and there, and also it just wraps around that feeling of, a well culture that everybody's advocating and reminding you if you so desire to engage. So let's go over some of the results. So this is where we looked at some of our own data, as well as all the wonderful work that the APA Foundation did for us too. So these were, just to give you an idea, our EAP, every year we get an annual utilization, and it has a combination of things, actual EAP cases, informational calls that came in various types of services. So this is about where we were, about 13%, and that's an overall. That's traffic to the website, actual activity on the website, management referrals, as well as mental health cases or other types of cases that needed to be set up. And we were at about 13.5%. We really got serious about our campaigning in 2016, and these were the results at the end of 2016. So you can see EAP cases increasing. We saw the slides earlier that we talked about. We did see traffic. This is consistent with what we saw preliminarily. with traffic going to the EAP for a variety of services. In 2017, we also offered a modest incentive for not to go to the EAP, but just wellness incentive in general. But you can just see the connection being made by watching these results. The connection being made between all that we had in the way of wellness and also what a resource our EAP was. It was like a light bulb was going off, and they were finding out more information that how they could really help, and they can self-refer and reach out, and that they had this kind of safety net, if you will. This is the results by the end of 2018 and annually for 2019. So we started at that 13.52 in the way of traffic and cases and whatnot, and we end up at the end of 2019 at over 70%. So again, this is telling us some good news, or at least an indicator. We also measured our engagement in general. So how were our employees engaging with us? And this is just a snapshot of 2016 versus the end of 2019. And we engage with our employees anywhere, depending on the month, between 2,000 and 4,000 times per month with all of the different activities that they're participating in. So that is demonstrated here in this slide as well. So these are some of our internal measurements. And this may be hard to read on your slide, but this is the perception survey that we send out every year, usually in the fall. And the first year we sent it out, we only had about 390 employees, I believe was the number that participated. So a very small percentage of employees. Now we get upwards in about 1,500 employees respond to this voluntary perception survey. But it has important questions on there, such as I believe that Kent State University cares about my health status. Being healthy is important to me. At Kent State, I am encouraged to lead a healthy lifestyle. It has a variety of perception, and you can see that all of them are going up to these more affirmative. 4 on here is agree and strongly agree, so we want to see those numbers continuing to come over here, and that's exactly what's happening. So not only are they just responding and engaging that way more so, but they are responding very favorably. I think there's some slides missing of, yep. The slides aren't in here of the actual data from the APA. So I'm going to talk through those actually. So there are some slides missing here, but what the research showed us in the APA research was that we could see, we looked at all the way through mid 2017. So they looked back from 2013 through 2017. And what we saw very favorably was the increase in self-referrals to the EAP, and we could see a steady line coming down of management referrals. Now, management referrals usually stem from the employee is kind of at this last chance. So something's happened that has put them in jeopardy of losing their position, and they have an opportunity to work with the EAP. So we saw those steadily come down, while on the flip side, we saw self-referrals for a variety of things go up. So the employees, to us, that was an affirmation that they're aware of the services and they're actually practicing using them on their own as needed. We also saw within our pharmaceutical data that antidepressants increased over that duration. So that too was an affirmation that employees, it was consistent with what we were seeing in participation numbers with reaching out and getting help for mental health, and that they were very likely getting also the medication that they may have needed for the condition that they were suffering from. On the claim side, we saw, for instance, and I'm sorry, I'm reading off paper here, but we could see in our pre-intervention period, so that early 13-14 versus the end of the intervention period that we were measuring, that the average claims cost per patient were in excess of $5,100 at the beginning, and it had decreased in our post period to $2,300 per person. So it was a really cut in half. So obviously a very positive affirmation on the claim side too, which is always something that the C-suite is very interested in seeing. And that on average, we could see about a $2,000 savings per member per month for those that were in the cohort with a diagnosis indicating depression, anxiety in versus pre to post. And then just a message, and again, I think this has come clear with our, what we would say here, by creating this culture of caring, of embracing the well-being of others and recognizing the whole person, it has really created a value proposition for our employees, not only as an attraction to come to Kent State, but also to stay here. So a couple things I'll just, say there as we kind of wrap up and we open up for questions. The wellness program, we have called it Wellness Your Way. Again, just affirming everything else that we've been saying about it is important to be about the employees and not just what we think they need. So we've made it very central. We have made mental health probably the forefront of a lot of what we do, but we've done it, I think, very creatively in that we continue to weave it in and out. And just little examples like you'll see in these pictures, for instance, this is just a lunchtime walk and talk. So using resources that are around, this is one of our architect, the director of our architecture office, taking us on a walk and really, helping us learn more about what's going on at Kent State. But this is a social aspect. A lot of people, when we think about mental health, one of the epidemics we see is really feeling isolated, not feeling a sense of belonging. And this gives people, we just meet at our rock, if you will, or our squirrel. We declare a meeting spot and employees show up. And this has become so popular, even though we couldn't do it this summer, that we've actually had to recruit a second speaker and buy headsets because the group has become so large. So we used to get 5 people if we were lucky, and now we're 50, 60 that might come out for this. This is just a fun rec and play day that we do once or twice a year, usually in celebration. And we recruit our rec department. This young lady is getting a lesson on shooting bows and arrows. So a lot of fun. You can see this is one of our Right Direction tables when Right Direction had its former look. And this is just a quick a lunchtime ride that employees can come jump on bikes with us. We focus on gratefulness because we know too what that can do for our mental and physical health. This is the Longest Day event, which is an event that we host to recognize caregivers of Alzheimer's patients, dementia patients. So we do have a speaker come in actually from our EAP that is there as a resource and have a little field day around it so that people can, just have that camaraderie. So it's a combination of things we do, very homegrown, very, so it does feel your own. And I think that's why it's been so successful here at Kent. And in fact, with that said, these are some of the recognitions that we've got. We're pretty proud of, really just growing something that feels very natural to Kent State, and then having it recognized by, different entities such as the American Heart Association and the Wellness Council of America, and even being recognized in Forbes on 2 occasions. So with that, that's going to be the end of my formal presentation, but I'd love to hear any questions that you might have. And that is my contact information if anybody would like to reach out to me, khauge@kent.edu, and I'd be happy to answer anything off the record as well.
Hi, Kim. First of all, thank you so much, and my apologies for some of the data. Some of it was proprietary, and we were trying to remove it from our handouts, and I think we got some strings crossed there. But first of all, I wanted to thank our generous support from our funders, Takeda and Lundbeck, who have helped make Right Direction possible. And then I would like to ask people to join us for our next virtual town hall, which is titled Depression, a Clinical Perspective and Impact on the Workplace. The presenter is Michael Chustik. He's an MD, board certified psychiatrist, and American Psychiatric Association Distinguished Fellow. The date and time is October 21st at 2 p.m. Eastern, and there is a registration link below. Just before we go to questions and answers, I just wanted to ask people to please visit our website at rightdirectionforme.com, as well as follow us on Twitter and LinkedIn. Okay, Kim, we have several questions for you. The first question that was asked was, has there been any university-wide collaborations with Right Direction and students as well?
There has not been on the student front. As you know, Right Direction has been primarily employer focused, but certainly that is something that I have shared with various student groups, a lot of the resources, because they definitely can be used. So I've encouraged them, when possible, don't recreate the wheel. A lot of this information can be transferable to students. But I'd love to see a Right Direction for students.
One quick question that was asked was, what kind of incentives do you provide? You mentioned small incentive. Could you kind of go into a little bit more detail on what that means?
Sure. So we do have a wellness program that we call, now it is entirely voluntary, but one of the things that, a couple things that we provide incentives for is every year we have what's called our 2-tier Wellness Your Way wellness program. It's not exclusive. If you don't participate and seek out the incentive, you can still do it. But if you would like the incentive, we encourage you, because we're encouraging good health practices, to have a biometric screening. So they would get their cholesterol, blood pressure, BMI, that basic information, and we ask them to complete a health risk assessment, because those two pieces will be put together by Be Well, who's the physician-owned company that we partner with for those services, and it creates a nice profile for them. And this gets into that educational piece too. It's important to educate them as to what you're asking for and why. So it will then green, yellow, and red light things that they might want to work on. So they're privy to that information. I am not privy to that information on an individual level, but I do get that information on an aggregate level. And that's very helpful for the university. And I think it's important for you to be very transparent on why you're suggesting things for them. But anyhow, if they do that, they get $100 into their paycheck or into their health savings account. And then there's a $200 reward that they can earn too. And that's really where we get into the Wellness Your Way. It has a whole menu of things that we create every year that address things around mental health, physical health, preventive health, financial health. And they pick what we call, what you didn't see on the video was this path. They pick their path. You participate in whatever you want to participate in, and you earn up to 350 points. That's the leverage point, and they earn their next $200. I will tell you that things like getting your vision, dental, and a physical have higher point values. So we are helping to drive them into some of those things, and it all becomes part of this preventive care and this self-care that we really want to continue to promote. So like I said, all these things are available to them. Whether or not they want the incentive is entirely up to them. But that's how we help to give a little nudge and a little reward for taking care of yourself.
Thanks, Kim.
And then we do have drawings. Go ahead, Sean. Sorry.
Just to clarify something, you did not hire any additional providers or vendors or purchase any additional services during this entire mental health initiative. Is that correct?
That's correct. The only one that I indicated that we partnered with this current year is Wellable, and that's so that we could do some platform challenges where, as a group, as an employer, we do things around different type. They may have a 4-week challenge on sustainability, or a 4-week challenge on, we're doing one right now on meditation. And I wanted a company that had a platform so that we could reach all employees to do some of those types of things and we needed some additional technology. And the nice thing about Wellable is they only charge you for the number of people that are actually participating and not the size of your group, your employer group. That would be the only, quote, new thing that's very mild in our strategy overall. So no, we really went back to the drawing board and said, what do we have and how can we maximize it for what we want to do?
Great. One question is, it is difficult to approach our executive team. Can you talk about the process of the first step? Can you talk about the first steps in that process and what it looks like?
So a couple ways. If you're specifically going for to talk about mental health and putting a campaign together, that sort of thing, I would really go in armed with the data. So make sure that you know what your data is telling you. What is the medical data showing you? What is your pharmaceutical showing you? If you do health risk assessments, what is that? So that you can put a short slide deck together perhaps and show the prevalence at your place, and then also have that research, which I think you can find on the Right Direction platform as well, about the costs that are associated with individuals that suffer from things like depression, anxiety, so that they can see the why. Why are you going in this direction? And then, you know, talk about your strategy. And the fact that Right Direction is a free employer resource is fantastic. We're a public university. We don't have big budgets. We're not for profit. So when Right Direction, you know, when we saw that out there and we saw that it was free and there was no catch there, it was fantastic, let alone the quality of it. So I would say go in armed with the data, but don't overdo, you know, kind of give it in chunks. And you might have to revisit them, you know, 2 or 3 times, but the data is very telling.
Thanks, Kim. Another question we had was in regards to the personal approach. When you're concerned with someone, what have you found to be some of the best words or phrases that can be used to not, quote unquote, invade their privacy?
Yeah, I mean, and this is some of what you can do in your employee and supervisor meetings to really help them understand what depression, for instance, or anxiety, what it looks like. And Right Direction has this awesome handout, you know, what it looks like to you, the person on the outside, and what it feels like to the person that's the sufferer. So if what we try to do, and I keep in mind when we're working with employees, if you're seeing something that wasn't present 6 months ago, a year ago, 5 years ago, don't assume that this employee has just checked out. There could be something else going on, mentally, physically, otherwise. So be empathetic, be that empathetic listener. You know, if you've noticed something, you want to have that conversation with them and ask them how they, you know, the observation that you've seen, and is there something you can do to help them? And then hopefully something will come out and you can offer resources such as your EAP or whatever other types of resources you might have to help support this person, including yourself.
Thank you. Another question is, how would you have addressed mental health in your organization differently? Or what other practical tactics would you recommend if you didn't have an EAP available?
I think that's when you have to, you know, look at what else do you have available? Is there something in the medical plan? Do they have some other types of resources or community resources? Or reach out to someone like Darcy at, you know, the APA Foundation for Workplace Mental Health. There are other resources out there. I did put a resource handout together. You know, you want to do some of the other legwork in some of these other entities, such as the APA, can help, you know, make you more aware, help you be aware of what might be available in your community. I would say, you know, your local public health departments, the crisis hotlines, those types of, to see what else, and to get speakers too. If you don't have an EAP, you can contact your local hospital. They, many of them have speaker bureaus attached to them, and they come out and they don't charge for their services, and you can have people come in and talk about different aspects of health, including mental health. Again, you want to help to normalize the conversation in the culture.
Great, and I think we have time for one more question. What are some of the ways that you helped your employees in terms of support during COVID?
I did put a handout, and I hope when you have a chance to look at it. So we, having built a pretty successful internal program, you find in this day and age that it's pretty easy. It was relatively easy to flip it and to make a lot of these things. Our employees still aren't really back to work. Most of them are still at home. So we wanted to keep that high touch we had. So for instance, we immediately set up within 24 hours a web page that was just directed towards handling what was going on. Our employees weren't used to telecommuting, teleworking, let alone all of a sudden doing it 100% and then being parents and school teachers and everything else. So we wanted to make sure that they were aware of the EAP, that they were aware that they had telemental health, that we had mindfulness coaching available to them, financial counseling. So we did this high touch around things that we knew could help them immediately. I even had a person reach out to me and say, oh my gosh, I'm just working. I'm forgetting to take my medication. She just was so frazzed by what was happening that first week. So we talked about setting alarms on her phone or setting appointments on her calendar, just simple things like that, and let them know that you're there. You're going to continue to be there. Just because we're working at home doesn't mean we're not going to be there. And then we set up things, informative things. We vetted resources for them and put those on our website. And then we always communicated with them. We never stopped communicating, doing that once a week, a direct email, making sure that we were in the faculty staff news, reminding them that we were there for them. We took all of our workshops and we spoke to the speakers and said, can we do this via a webinar? We need to stay connected with them. We need to continue to support them. And they did. We didn't have anybody turn us down. So we kept that going. Then we tried to build things that they could do together because they were feeling so isolated. So we had a online gratitude graffiti board. So they were putting up what they were grateful for on this digital board that we had, and everybody could read anybody else's. And that was very uplifting, I think, to anybody, or if you needed a pick-me-up, that was a great place to go. We did a recipe, an In It Together recipe collection. So anybody that wanted, because everybody was cooking at home now, nobody was going out. So we shared recipes together, and again, trying to build community. And then we, that engaging and just reassuring them, practice your self-care. Don't forget that. Reminding them again about financial and other things. So we have a real nice handout that you can kind of see how we kept the high touch. We built community. We stayed informative to them, and we continue to try to find ways to engage them and just keep that going. So it's really what we were doing, but we just had to, be a little imaginative of how we can continue to do it.
Okay, Kim. Well, that's all for the questions. So we have time for it. Kim, thank you so much for your time and your insights and your wisdom. We really appreciate all that you've done.
Thank you. And Sean, I want to thank Employers Health and Darcy, obviously your entire team there, helping us on the research project and everything else that you've done. So you're a great resource too, with the right direction. So I encourage anybody that hasn't explored it to go and do so.
Thanks, Kim. You shared really great practical information, so I hope everyone gained great insight. So thank you so much, and thanks everyone for participating. Hope you join us in October. Take care all. Stay well.
Bye-bye.
Bye-bye.